Welcome back to Daniyal Ultrasound, Dadu. Here we have got a lady patient, young aged, complaining of heaviness with dull ache in the right lumbar region. On ultrasound, we have got this picture of the right kidney. Here, the most important thing is that we have to differentiate between renal cortical cysts and dilated calyces, because obviously in this case the kidney appears severely dilated, showing severe hydronephrosis or dilated calyces. But in most of the cases, it is quite difficult and becomes tricky to identify or differentiate between cortical cysts and the hydronephrotic kidney. So, especially in case of multiple cysts in the kidney, it becomes hard. So I will tell you few important tips to understand or differentiate between cysts and severely dilated calyces. First of all, the cysts are usually they arise from the renal cortex, and they are usually found at the corticomedullary distinction. So dilated calyces, they are they always communicate with the renal pelvis. If you trace them, they will open up ultimately into the renal pelvis. Here is you see these are calyces. They open up into the renal pelvis. So this is important thing to understand. And the second point is the shape. Typically, round or oval and well circumscribed cysts. They are spherical and anechoic lesions with smooth walls. So this is the second point. The third one is that the calyces are usually irregular and branching, and they look like cauliflower anechoic structures. So this is important. And the third one is distribution. Uh, Usually, cysts are seen scattered randomly in cortex or medulla, not in the predictable collecting system pattern. So, dilated calyces, they are symmetrical usually, multiple, and always connect to each other and forming a hydraulic pattern. So, these are few points. And the fourth and the not last but not least is that the calyces, severely dilated calyces, if you trace them, they will definitely open up into the renal calyce. So these are important. This case shows severely hydronephrotic kidney. Here you see calyces are severely dilated, and there is a loss of corticomedullary distinction as well. Paper thin cortex is seen here. The calyces, they communicate with each other. You see communication is there. So this is severely hydronephrotic kidney. Now the important question arises here is that why the kidney is severely dilated. So in most of the cases there are stones in the ureteric area or pelvic-ureteric junction, but in this case we do not find any obviously obstructing stone in the pelvic area. So probably this is a pelvic-ureteric junction stricture. So this patient has to undergo further investigation to get the obstructive uropathy. I do not find here any obstructive uropathy. Obvious strictures cannot be found on ultrasound. So patient has to undergo IVP or MEG 3 scintigraphy. Thank you very much.